Here we go. Hi, everyone. We'll get started in just a moment as people settle into their Zoom boxes. Welcome to the Silver Hill Grand Rounds, and get started in just a moment. All right, I will go ahead and get started. Hello, everybody, and welcome. I am Dr. Jeff Katzman, the Director of Education at Silver Hill Hospital, and we are absolutely delighted to have you join us for our resumed Grand Rounds program. We've taken a couple of months off for the summer, and here we are back together again, and are privileged to kickstart our fall series and welcome a friend of mine, Dr. Lindsay Smart, presenting on the topic of diversity, equity, and inclusion, how to address microaggressions. I will have the pleasure of introducing Dr. Smart in a moment, but first, some important housekeeping details. Our Grand Rounds continue after the summer break with 2 Grand Rounds this month. Dr. Smart today, and then Dr. Michael Bogenschutz talking on understanding the transdiagnostic effect of classic psychedelics on September 28th at this same time. You can find all of our upcoming Grand Rounds on our website under Education and Resources and then Calendar. Back to today's lecture, we would love to hear from you. I will moderate a Q&A discussion with Dr. Smart at the end of her presentation. This is your opportunity to put forward questions and comments to Dr. Smart. You can submit a question anytime over the course of the talk using the Q&A box at the bottom of your screen, either with your name, or if you prefer, you can submit that anonymously. To receive CME and CEU credits, please complete the evaluation survey that will pop up in the browser when the webinar ends. And finally, disclosures. No planners or individuals in control of content for this educational activity have any relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. So with that, it is now my great pleasure and honor to introduce our guest speaker today, someone I've known for a bit of time now, Dr. Lindsay Smart. Dr. Lindsay Smart is an Associate Vice Chancellor for Leadership and Faculty Equity and Inclusion at the University of New Mexico Health Science Center Office for Diversity, Equity, and Inclusion, and also an Associate Professor and Licensed Clinical Psychologist in the UNM School of Medicine, Department of Psychiatry and Behavioral Sciences. Dr. Smart received her BA degree in psychology at the University of Portland and her MA and Ph.D. in clinical psychology from the University of Denver. During her time as a graduate student at the University of Denver, Dr. Smart was an American Psychological Association Minority Fellowship Program Fellow. She completed her pre-doctoral clinical psychology internship in New Mexico at the Children's Psychiatric Center, and her postdoctoral training was completed with the UNM Division of Community Behavioral Health. Dr. Smart is committed to ensuring there is a diverse healthcare workforce in New Mexico. Currently, she is involved in initiatives that contribute to the promotion of diversity, equity, and inclusion among faculty, students, and staff within the UNM Health Sciences Center. I must tell you that I learn something every time I sit and hear Dr. Smart talk. A few personal notes. I think I want everyone to know that Lindsay is really beloved by everyone in the Department of Psychiatry and Behavioral Sciences at the University of New Mexico, which is part of why I asked her to meet with us today. She works with faculty to understand the complexities involved in diversity, equity, and inclusion, and works with every class of our trainees, providing a whole series throughout the year geared toward their level of learning. She now holds a major leadership position, as I mentioned, for the entire UNM healthcare system. I must tell you that the psychology interns who she leads, and who work for her, adore her, and they generally do as they're told, unlike the psychiatry residents in our program. This is a bit, an example that came to my mind was during COVID when we prepared a drive-through thank you program, a gift program for all our trainees. Indeed, every psychology trainee made it. I cannot say that our psychiatry residents had the same level of presence for their presence. Dr. Smart inspires thoughtfulness, professionalism, and a degree of pride for what we all do. And it is an honor for me to bring her virtually to Connecticut today. I was delighted when she agreed to talk to us, as I know that many people asked Lindsay for her time. So a big thank you and welcome, Dr. Smart, to Silver Hill.
Thank you very much for that introduction. I'm very appreciative of those kind words, and I very much feel like I have had a very great home in New Mexico from my internship training all the way through to where I'm at professionally. So I'm grateful for that feedback. It is great to be here with you all today. I'm in the morning and you all are getting closer to your afternoon. And the topic that I am going to be endeavoring to provide some content on, and hopefully some elements of reflection, and then potentially the opportunity for folks to think about how they can act on the reflection to address microaggressions. This is something that I am never 100% certain of anything in life, but I have a high percentage of certainty that most of us, including myself, have engaged in or witnessed some sort of microaggression in either our professional or our personal lives. And I, like I am sure many folks on this call, haven't always addressed it. And I haven't always known what to do. And I haven't always felt like it was my place to do something when I experienced or witnessed a microaggression. So when I deliver this talk, I come at this from a very kind of personal implementation perspective. I am not a researcher on microaggressions. I look for those, some of whom we will be cited in today's talk, to try to inform how to put this into practice in my own spheres of influence here at UNM, whether that's with faculty or staff or the department or the internships or other learners on our campus. So with that, I will get going into our talk. First, just a slide just to reinforce what Dr. Katzman shared, that I have no financial disclosures to relate with regards to this presentation. I'm going to start our conversation today with our Indigenous Peoples Land and Territory Acknowledgement. Today I'm actually probably about 20 minutes off campus. And this statement is written as though it was an individual who would be sitting on campus delivering a presentation. But the statement still applies to much, if not all, of New Mexico. Founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia. The original peoples of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history. I also like to circle this announcement with an acknowledgement of those voices who are not here today, who perhaps have been silenced through oppression, silenced through deportation or violence. I think when there is talks related to diversity, equity, and inclusion, especially in academic realms, it's important to acknowledge which voices get amplified and which ones perhaps haven't had that same chance. And considering that aspect in the work as we go through thinking about microaggressions today is important. I also want to acknowledge your time, or just the element of time in general. I know that folks, especially those involved in healthcare, are multitasked these days. And so I am appreciative that you have chosen to spend some time with me this morning, afternoon, and hope that there is something in here that you find useful to yourself personally and professionally today, and then of course moving forward. Two big goals that I hope this presentation hones in on more specifically are at least an awareness of what microaggressions are from a couple different perspectives. And the more we are aware and can name the things that we're looking for, we can reduce the likelihood of committing microaggressions for ourselves. And then the next step would be to think about this presentation as a vehicle to help you intervene and prevent microaggressions happening to yourself or to those around you in your professional spheres. One of the primary resources that I have found useful in my work, and that will pop up at different points today in this presentation, is a book that you'll see at the bottom of the slide, and the slides will be made available to you after today as well, called Subtle Acts of Exclusion: How to Understand, Identify, and Stop Microaggressions by Tiffany Janner. And this opportunity to read this book was very practical. It had examples, it had tips, it had information that I think would be a great opportunity if you have discussions within teams, if you happen to have an institutional-wide book club, to really dig in a little bit deeper in the area of reflection with regards to thinking about microaggressions and how they are an act of exclusion in many of the environments that we operate. So starting back with just some very basic origins of the term, we have this term microaggression that, at least from the work that I've been able to gather and through many references so far, have been attributed to a Harvard psychiatrist named Dr. Chester M. Pierce in the 70s. One of the significant pieces to note about microaggressions is that the origins of the term started really as a way to consider the experience of Black African Americans, particularly within academic environments. Since this time, the term moved to look more specifically at women or individuals who identify as female in academic environments, and now has expanded to include a much broader understanding of how microaggressions can impact individuals who would be likely to be marginalized in our academic settings and professional settings and workplaces. A quote attributed to Dr. Pierce: "One must not look for the gross and obvious. The subtle, cumulative mini-assault is the substance of today's racism." You'll hear at different points today this terminology about how subtle microaggressions are, that they add up and are cumulative and build up over time, and that there is this shift in movement across the decades from what would be more overt signs of discrimination to, especially thinking of our academic and higher education institutions, things that might be more subtle and slide under the radar. Darrell Sue is one of the significant researchers to continue the work of understanding microaggressions, and the contributions that he has made are very important in the way that we can think about understanding and broadening how to understand, define, and then therefore address microaggressions. One of the definitions that is attributed to Dr. Sue and his colleagues in some early work defines microaggressions as brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative racial slights and insults towards persons of color. I think that this, of course, builds on some of those key terms from the previous statement, that they're subtle and they build up over time. This brings in the element of intentionality, which is one of the areas that also we'll touch on in thinking about microaggressions and the intent and impact that they have on individuals, both the victim of a microaggression and those that might be witnessing it. I also want to hone in on the academic environments and the professional and hospital-like settings that many of you all may be practicing and learning in or teaching in. And the important element of really understanding and recognizing the impact of microaggressions is that many places there is less overt racism, discrimination happening in our academic settings. I'm not saying it doesn't exist. It absolutely still happens in overt ways. But for a larger majority of folks, they are experiencing these more subtle signs of what would be considered racism or sexism or other forms of discrimination that slide under the radar. And I want to highlight then just how important this understanding and addressing of microaggressions is in creating inclusive environments, doing what we can to retain a workforce in settings where for many folks it's hard to hire and retain individuals within especially behavioral healthcare settings. This is a diagram that I wanted to include here so that folks would at least be alerted to it for future reference. This is tied specifically to racial microaggressions, but it could very well have adding in a diversity characteristic in front of microaggressions instead of racial microaggressions. And what I hope to highlight with this diagram is a couple things. First, it's to think about microaggressions as not just being verbal. We often think about the things that we hear or say as the evidence of subtle slights, but there are other ways that microaggressions can appear through both our body language, the way we engage with people non-verbally, and then also considering the environment and the structures and the systems that we operate in as also being a potential source of microaggressions. Microaggressions in this diagram, broken down by Dr. Sue, talks about how it can be also considered as a micro insult, a micro assault, and a micro invalidation. You'll notice that micro insult and micro invalidation have a focus on being unconscious, meaning that it's likely that these are happening without us recognizing it, and that it may engage in us acting in certain ways without the intent or the meaning of doing so. A micro insult has the implication of communicating rudeness, insensitivity, oftentimes demeaning somebody's racial heritage or other diversity characteristics. And the micro invalidation has an implication of exclusion, negating or nullifying somebody's experiences, often in a way of making somebody feel lesser than somebody else. Micro assaults hone in on more of a explicit and more violent or aggressive with the intention of harming. This could be very specific with names. It could be very obvious avoidance and exclusionary tactics, and often crosses the line into discriminatory actions and behaviors. So for today, in thinking about microaggressions, we're really actually thinking more about the micro insult and the micro invalidation than we are about the micro assault. The bottom part of this diagram indicates some of the things that we'll also unpack on a couple of slides to follow, about what is it that is communicated and implied and thematic in evidences of microaggressions. And these are a couple themes that were pulled through Dr. Sue's research. That a microaggression has the implications of ascribing lower intelligence or different levels of intelligence to somebody based on their diversity characteristics, implying that somebody is lesser than or a second-class citizen to another individual. Pathologizing cultural values or somebody's communication styles with the notion that somebody's own personal style is better than. Having assumptions about somebody's lived experience or criminal status based on their race or other discrimination diversity categories. Implying that somebody doesn't belong here based on their diversity, visible or invisible diversity characteristics. Ascribing colorblindness as a way of demeaning somebody else's lived experience. The myth of meritocracy, that race plays a minor role in life success, that somebody didn't have to work hard. And denial of individual racism, and that somebody's role in perpetuating has been somehow not as significant as somebody thinks. So these are just a couple examples of themes, and we'll talk about a few others as we untap what microaggressions are and how they can be experienced by others. Before we slide into that, just a quick note on the environmental microaggressions. As we move to thinking about the role that our systems and our structures play and how important it is that we do the individual work and that we reflect and we move ourselves, it's just as important for us to think about the systems that we operate in and how we can address those when we think about microaggressions as well. So when we're thinking of environmental microaggressions, these are often areas where policies, practices, laws, institutional traditions are embedded within the environmental structure that you might be in. I think that this is a really relevant area to think about as we look at how environmental microaggressions might pop up in such things as our hiring practices and recruitment tactics, as we think about promotion and tenure and who has access to career advancement, thinking about leadership titles and who's assigned them and who's not. A lot of times microaggressions, environmental microaggressions pop up in those ways that practices and policies are either written or in perhaps how they're followed. And so I wanted to make sure that as you reflect on this work today, that you think about any areas within your professional lives that you might consider the environment as an area of intervening in thinking about microaggressions, just as much as we think about intervening with people and individuals when microaggressions occur as well. So this is an opportunity to take a subtle twist on thinking about how microaggressions can be redefined. I think I have often just even my personal conversations thinking about microaggressions, and when you think about unpacking them, they very rarely feel micro. They're often big. They often are things that you think about for days, if not weeks, if not years. They are definitely an element of aggression and feeling threatened. And so I appreciated Jana, and I think I forgot to share Michael Barron's name when I introduced the book. I appreciate their way of reconceptualizing how to think about microaggressions, because I think it's an opportunity to then engage in conversation with our colleagues and individuals in a way that sometimes using the terminology microaggressions might tend to close doors and make those conversations a little bit harder or more harder than they should be. And so when thinking about how Jana and Baron reconceptualized microaggressions, they name it instead as microaggressions. They call them subtle acts of exclusion. And so we look at unpacking what that means. So we've still got the element of subtlety. Again, the element of it's confusing. You can't quite tell if you heard that the way that everybody else heard it, or experienced it the way that everybody else experienced it. And it makes you second guess yourself, thinking, is this even something that I should say, or that I witnessed? Did I experience that the way that somebody else did? A lot of times it could be that it's subtle to you, but it's more obvious to others, depending on what kind of marginalized group was addressed or targeted in a microaggression or subtle act of exclusion. These are statements that are meant to exclude rather than include. So reframing microaggressions as opportunities of taking out of redistributing and removing individuals from access to things, whatever that might be. Oftentimes it's a resource or power or something within the system that is being protected. And I appreciate thinking about microaggressions in this term because it allows me to then think about interventions in a different way, which we'll also chat about in a couple of slides. The same definition as it's redefined still says and implies that there is not implied intent with a subtle act of exclusion or microaggression. That doesn't give folks permission to continually engage in a subtle act of exclusion or microaggression. But it is an opportunity to focus on the impact that these are having on our individuals in our workplace settings. I think it's a very hard thing to differentiate between intent versus impact. And I often struggle with that in the heat of sort of a situation where your anger rises, and it doesn't matter if I know cognitively that the intent isn't there. It feels like it's intentional. But focusing and recentering on impact gives an opportunity to repair in a way that focusing on intent doesn't. So when I'm thinking about understanding interventions, if I can move myself or others to thinking about the impact rather than intentionality, the first step of engaging in a conversation about how to address and fix and repair may be a little bit easier. So when we think about these frameworks for subtle acts of exclusion, Jana and Baron focus on what is implicitly communicated when a subtle act of exclusion is occurring. And they came up with this list. And the list says that these statements are saying that somebody is invisible, that somebody or people that are like you are inadequate, that you are not an individual, that you don't belong, that you are not normal, that you are a curiosity, that you are a threat, and that you are a burden. And unpacking microaggressions or subtle acts of exclusion in this way, as thinking about the role that we might play in either in committing a microaggression or addressing, really hones in on this personal human component of thinking about what is this significant impact that is happening on a daily, regular basis for individuals when these happen. And so, in the reflective moment, just thinking about going through your days and having a cumulative effect in a workplace setting of feeling these things are likely to contribute to lots of sort of psychological and physical factors. We're not going to delve into that research, but there is some that is there to talk about how this impacts our physical and mental health. But from a perspective of what we hope to do, what many of you I'm sure are engaged in figuring out how to build and sustain a healthcare workforce, these individuals experiencing these are not likely to want to stay in a place where that is their cumulative experience. So it is very important for us to think about sort of the health of our professions and how important it is to address these subtle acts of exclusion and microaggressions so that we have settings and places where individuals aren't experiencing this on a daily basis. Subtle acts of exclusion and microaggressions really have an additional implicit or sometimes more explicit communication that is happening about how to maintain a system of power and maintain inequality. And what you're trying to do is protecting a resource that you don't want to share or have with others. And so that's like an implicit communication that could be attributed to a subtle act of exclusion or microaggression, whether that's what you intend or not. That the feeling and impact for an individual is that they're not valued in that system and can't have access to that resource or power. And just another plug for how important it is to understand the role that addressing and understanding subtle acts of exclusions and microaggressions has in creating inclusive environments and creating settings where teams can work well and better together and create effective healthcare places as well. So now that we've talked a tiny bit about what microaggressions could be and how they could be defined and redefined, I wanted to switch into thinking about what to do and how to do it. One of the big pieces before we go into these slides is it's very easy for me to sit here and tell you some strategies to do. And it is very hard to do these in real life. One of the important follow-up steps is to think about how to engage people in your areas in discussions about these activating bystander strategies, allyship, or just understanding and talking about their experiences of microaggressions in various settings, because it does take connection with others around us in order to really implement many of these strategies, because they're hard, they take time, and they require you to have support as you navigate them in your lives. Many of the existing strategies that we have for thinking about microaggressions really focus on the after the fact. So the microaggressions happened and you're trying to think about, what do I do now that it's happened the next day or the day after? And there's absolutely a role for those strategies. And I think that there's not one of these that's above the other, thinking about their importance and their effectiveness. The challenge with this strategy as the only way of implementing it is many, if not most, microaggressions or subtle acts of exclusion go unreported. There may be complaints. Oftentimes that's because something has reached a pinnacle and it's sort of the last straw, which is often the hardest place to intervene at that point. So in thinking about activating bystanders and allyship, this is meant to be a way to add to that repertoire of thinking about addressing microaggressions, not after the fact, but closer to the act or immediately as they're happening. Activating bystanders, having allyship, also creates this other element, sort of side effect, if you will, of creating a shared collective responsibility, which impacts more than just thinking about microaggressions. If you think about how teams are built and how effective teams are built. So this shared collective response that can be activated when multiple people sort of are upstanding in these situations and addressing microaggressions in the moment serves not just as a way of preventing future incidences, it opens up the dialogue and it creates this overlying feel of a community and team that you all are shared in this work together. And active bystanding is very hard. Many times we want to intervene and we oftentimes talk ourselves out of it, either because of the sort of dynamics that are happening in the room or the Zoom room, or because the time it happened so quickly and the time has passed. And fear is a really dominant emotion. It overrides many things and prevents us from perhaps acting on our own personal values, our own personal integrity, our own feelings of compassion many times. And one of the elements that triggers that fear is thinking through these subtle acts of exclusions and microaggressions are oftentimes involve power dynamics that we will talk a tiny bit about in the next few slides too. When thinking about engaging individual action, one of the significant prevention and baseline things to focus on is empathy. And yeah, I think this is like the challenge of thinking through our Zoom world versus in-person world, and how to amplify Zoom in a way that might allow us to actually connect with individuals that we may not spend time with, but also to think about how we do this in this sort of new world we're in with technology. The more we spend time with people who are different than us, who don't see things the way that we do, don't have the same lived experiences, aren't exactly like us, the easier it is for us to amplify empathy as a counter to the fear that we might feel in these situations of standing up when a microaggression is occurring. We'll talk a little bit about microaffirmations at the very end as an opportunity to think about how that can be an important role in building empathy with others in our lives. And if we go back to thinking about subtle acts of exclusions and what they are communicating to others, turning that inward to ourselves and really honing in on the fact that even though we may not be the leaders of a big institution or even the leaders of a dean or leaders of some sort of unit, there are people in our spheres of influence that we communicate with on a daily basis. And even with that small group, we have the capacity to counter and those microaggressions to help people feel that they are enough, that they are an individual, that they do belong, that they are normal, that they are special, and that they are safe. And if we can just hold on to that feeling and that capacity that we all have within us to do that in these moments when microaggressions or subtle acts of exclusion are happening in front of us, we can utilize the empathy that we've built because we've engaged with people whose lived experiences might be different to us, and to quiet the fear that we might have and still intervene and speak out before we talk ourselves out of it. What is an ally or bystander? I think that there are lots of ways to think about what an ally is. Here is one way to think about it. This was actually an article that I found that was from an NIH researcher blog that I found fascinating, the resources down there on the side. But an ally recognizes that though they may not be a member of a marginalized group or groups, they support, they make a concerted effort to better understand the struggle of another's circumstances. Sometimes an ally does come from a place of more privilege and a recognition that they have privilege. And sometimes it's not necessarily that they have more privilege in that situation, but they have their own experience in navigating being an ally for other marginalized groups in order to address ignorance and intolerance when it arises. And being an ally doesn't necessarily mean you have to completely identify with the experiences of injustice or oppressed group, but it does mean you will stand with them and for them in the face of discrimination. And so as a reflection of that, when you're thinking about whether or not you have the capacity to speak up and be an ally and activating your bystanding instincts, that you are standing with somebody in support of somebody, and that is a significant signal to individuals that you are in support for them. There is a TED Talk here. If you're a TED Talker, I like TED Talks. I use TED Talks a lot when I'm trying to kind of change up learning a little bit with our interns and even just with faculty, because they're often very succinct speakers who can communicate very significant points within, of course, the 10 to 15 minutes that they have. So this is one TED Talk that I think is a useful one for folks if you have 10 to 15 minutes in your day today or another day to look at, to talk about how to be a better ally in the workplace. And these are the key parts of the talk that I've put here in the slides for you. So start by doing no harm. So one of the big pieces of thinking about being an ally is that it's a place of listening and learning and unlearning and relearning and making mistakes and to keep learning. If you do something once and you don't repair it, then that's likely to engage in harm. But if you do something and then you learn and you listen and you address and then you do it better the next time, that is the element of not doing harm. It is okay to make mistakes. Like I said at the beginning, we have all engaged in and committed microaggressions, if not witnessing them. What is important is what you do next. And how do you repair and fix and address in situations. Full attention is important. We have a very multi-divided world of lots of things and to pull us in different directions. And so thinking about in conversations, in dialogues, how important it is to be fully engaged. Whether that's putting your phone down, whether that's making eye contact, if that's something that's comfortable for you and appropriate, whether that's making sure you empathically listen and rephrase and report back what you're hearing in different situations. But being a bystander, being an ally, involves attention, and the communication that attention has is important. Not interrupting, going back to the listening. Being a bystander often does mean at times taking a step back and being able to hear more than talk. Of course, at some point, being an active bystander does imply saying something because you're interrupting a situation, but understanding that in certain situations, underrepresented people are more likely to be interrupted. And reflecting on that in our work will not only help with understanding how to intervene in a microaggression incident, but also to think about how to not actually engage in committing a microaggression yourself. Amplifying ideas, recognize the great ideas that those around you have, and attribute it to the person or the people that have had it, and bringing it into conversations is one way that those who might have power and privilege can be an ally and amplify the voices of those who are less likely to be heard. Consider the language that you use. When you think about microaggressions and gender identity and the intersections with that, recognizing pronouns. What are somebody's pronouns? How do they describe themselves with their ability status, their race or ethnicity, their religion? And those are things, if we go back to thinking about building empathy, talking with people we may not normally talk with, listening and learning, that help as a bystander to really understand and engage empathy. And also when you do speak, utilize the language that will help the individual feel seen and heard. Advocate in small ways. Try to change the power dynamics in the room if you see them. If there is only one person of a specific identity, this usually works only for visible diversity characteristics. And you notice that that person's being interrupted often to say things. So advocating in the various meetings that we're in, for example, we have lots of meetings in our daily lives, and being able to pause conversation and return to somebody if you find that they have been interrupted in making a statement. Inviting folks to speak. And there is some literature that looks at this sort of call in versus call out, and how do you create an environment of safety, or an environment, space where folks feel like they would like and can share their views. And if the space is right, inviting individuals to share their ideas is a way to break up some of those power dynamics in the room. As researchers that might be here, or those who engage in panel talks, I think that there has been some clear leadership on this from folks from NIH. Don't engage in panels if there isn't some representation in diversity, as an opportunity to ally with amplifying the voices of those who are less likely to be able to have those platforms. Making sure you encourage and put people's names in front of jobs, encouraging them to apply, but also nominating them to any committees or awards that seem relevant to the work that they do. And then thinking about, as an ally, that they're thinking about those areas that you might have privilege, and that having privilege in itself is not a bad thing. But what you do with that privilege to elevate others, to bring people up with you as an ally, is what is critical in creating change in these situations of both microaggressions and perhaps thinking of allyship and other forms of oppression that happen too. Being a mentor is an important part of not just allyship, but thinking about how to support individuals when they have experienced microaggressions or subtle acts of exclusion. Mentoring is significant, and I know that there's lots of work being done on trying to understand how to improve this on many campuses, how to make it something that is works for individuals who may not come from dominant groups. Being a mentor is a signal that you are there to support somebody through some of the very important elements of their career that often lead to significant resources. That's pay raises, that's titles, access to things that validate their research or their lived experiences in their professional and clinical work. Volunteering is an element of being an ally, being able to help with programs within your area of interest, programs in areas of your cities or towns or states where there may not have regular access to individuals who are healthcare providers or researchers or academics. And then where you have the sphere of influence, to think about how you transform your team as an ally so that it is inclusive, that you are held accountable for making sure that there's representation on your teams, as a direct evidence and commitment to making change in the work that you do. The strategy that I mentioned earlier, which is called micro affirmations. So taking a little bit of a spin on microaggressions, and to build on that is, instead of making subtle acts of exclusion, thinking about intentional acts of inclusion. How do we bring people into our spaces? Again, to connect people with those who they may not necessarily connect with, but also to help elevate the voices of those who may not have those opportunities. These are tiny acts of opening doors to opportunity, gestures of inclusion and caring, and graceful acts of listening. Invite opinions, invite dissenting voices. It's okay if not everybody agrees. It's how you do those conversations and that engage in the voices. Silence doesn't mean agreement most of the time. What's important is that we engage in dialogue so that some sort of sense of understanding is arrived at, and inviting those opinions of those who are least likely to speak is a way of affirming that they are welcomed, that they belong, that they matter in these dialogues. Listening actively, engaging in personal stories. Thinking around narrative medicine and thinking about the patient stories. We spend a lot of time in tasks in our work, and of course those tasks are very important. But creating some element of a workday that helps you and others to be seen at a more personal level are important in building empathy, creating those environments of inclusivity, and affirming somebody's presence in your spaces. Those can be getting lunch or coffee with somebody that you usually might not network with at work. And those can be opportunities that are built into meetings as well. Giving credits to others is one that I mentioned earlier as an important strategy for leaders in particular to elevate the work that those under them might have been engaged in. We have to think about systems, not just individuals, in thinking about how to address microaggressions. As we move towards diversifying our classrooms, our providers, our spaces within academic settings, it's going to happen. Microaggressions will happen. Subtle acts of exclusion will happen. That is not giving it permission, but I am offering it as a way that if you wait for it to happen and think that it won't happen, you won't be prepared to address it when it does. And so if we know that bringing people together in a professional setting is something that hasn't happened before, and you're going to engage in these moments where microaggressions happen, we are obligated then to prepare for that in order to ensure that the environments that we are trying to diversify are places that folks want to stay and are retained in the future as well. If we expect them to happen, again, just to reiterate, it's not giving individuals a permanent path to continually microaggress or exclude without trying to improve. But it is saying that we need to create recognition that it is and will happen in order for us to really think through what are we actually going to do to improve the situation for individuals. Organizations, therefore, should be very clear about the communications and expectations. Leaders should model it. Leaders should have policies if it can reach that level, or at least guidelines and practices, and should be able to have opportunities to demonstrate when it happens, how to respond as a kind of leadership role that many folks have within institutions. And leaders also need to work on the element of creating spaces where people feel like they can speak up and that talking is encouraged, and that there is space for having conversation about microaggressions or subtle acts of exclusion. The goal is not punishment. And I think that that's a very tricky, hard one for many folks to hear. It doesn't mean that there's not consequences and room for improvement, and that there's a role for thinking about perpetual experiences of microaggression. If the goal is to change the behavior in the settings that we're in, it's figuring out how do we move folks from acknowledge and have them acknowledge that it is happening, name it, and bring the group together to repair it. Allowing them to go unaddressed at a systems level is a recipe for disaster. Microaggressions have to be addressed, preferably at least by a leader if the rest of the groups that's surrounding the incident can't happen, aren't ready or prepared yet to address it. Because if these acts of exclusion continue, microaggressions continue, they interfere with the individual sense of belonging, which in turn will interfere with the team's functioning, and the element, as we go back to retention and figuring out how do we build a workforce where folks want to stay, they have to go be addressed. If there is no response, there are these messages that are implied, and they'll go unchallenged. There is a continued sense that individuals won't feel like they don't belong, that they are not recognized, that they're not valued, and therefore, why stay? Why stay in a setting where that is your daily experience? And here are just a couple examples that thinking through a employee that identifies as male consistently interrupting a gender non-binary individual in a meeting. And if that's not addressed, it's not just something that will quiet the person that is microaggressed against, but it will impact the rest of the group to the sense that perhaps no other voices will speak up in meetings. No one will feel that their voice matters or is valued, and may lead to individuals eventually leaving an organization, hopefully for a place that is more supportive of them. So that was a lot of information, and the element that I hope folks take away from today is that there's a broadened sense of what microaggressions are, how they can be evidences of these acts of exclusion, why it's important to intervene as an ally, and that we all have those skills and the capacity to help improve the situation, and that there is systems-wide and leader accountability that is very significant in creating an atmosphere where subtle acts of exclusion are named and addressed and repaired as the teams are built. So that concludes the content area. I am
All right.
hand it over to Dr. Katzman.
Dr. Smart, thank you so much for your wisdom in this area and your manner in presenting it in such understandable ways. So greatly appreciated. So 100 people out there interested in hearing you, please, I would encourage anybody to start using the Q&A function that we have to put questions in the chat for me to get to Dr. Smart that we can talk about. Would greatly appreciate that, and I'll go ahead and start us off. I'm wondering, Dr. Smart, kind of in your, can you say something about the role of, I know at UNM we have had various kind of mandatory reporting requirements, even of bystanders when we witness something. Can you say something about kind of your idea of the effectiveness of that versus saying something kind of in real time? And is that something that organizations should think about in terms of like mandatory reporting of what we witness?
Mm-hmm. Well, I think that there's a place and an importance for both. I think for repeat offending, for folks who perhaps their values at this time don't align with thinking microaggressions are important, policies, rules should be in place so that those consequences can be held at like an institutional level. And so I think that's where some of those mandatory components come in. But when I think about real level change, I think that I don't think that they necessarily hinder it, but I don't know necessarily if I feel like it helps. I think that the dialogue, the personal connection, this element of modeling that happens within systems from leaders in particular probably plays a more sustainable role in addressing microaggressions on a kind of daily basis, more than the mandatory reporting. But I do think that there needs to be something formal in place, because there will be situations where it just can't happen in that dialogue, and that protects the system and the individual as a whole by having some mandatory pieces in place.
Mm-hmm. Great. Thank you for that. And our questions are rolling in. I'll go ahead and turn to Michaela Scully, who asks, if a culture is known for being less diverse, how do we go about attracting more diverse folks to a space where those in the beginning may feel less represented at first?
Mhm. Well, one of the strategies I think is important is diverse leadership as a starting place. So if the system as a whole isn't diverse, but there can be at least some indication that there's leadership that's diverse, it's sort of this opportunity to kind of tie a few things together. I think that myself included, I'm often more comfortable with an environment if I know that somebody in charge might look or have some sort of lived experience that I have. So I guess that's probably my first place to go. I think that you can create support and allies within a maybe perhaps less visibly diverse group than creating those spaces where people know that perhaps they might be the first of some group to join, but that there's an environment of support for them. I think probably my third prong approach is that diversity surrounds us everywhere. So I think one of the pieces is unpacking is thinking about racial diversity or gender diversity or sexual orientation, actually those two specifically as sort of more visible diversities. But perhaps there's also a way to consider really understanding all of the different facets of the human experience that people have, and how do you amplify that as a way to bring in perhaps the racial and gender diversity, which we spend a lot of time really focusing on in certainly our environment at UNM, is how do we bring those numbers up? It is, the mentorship probably would be the fourth thing I would add to that. And what likely has to happen is the mentor can, if somebody sort of is coming in and they're maybe not represented in the group that they've joined, utilizing cross-network mentorship, whether that's somebody within the institution that's not directly in a department or division, or perhaps even broadening to mentorship outside of the organization, so that there is some neutral support for somebody who is perhaps the first of their personhood to be kind of in that mix. I'll stop there because I see there's some other questions.
Yeah. Thank you. An anonymous attendee writes in a question. You mentioned, Dr. Smart, that behaviors need to be addressed by the organization. What are your recommendations when organizations do not see or bring up these problem behaviors? For example, individuals from marginalized communities do not feel safe to speak. And a follow-up question from an anonymous attendee is next, how do you start a conversation with leaders of a workplace without being punished? A couple related questions there.
Yeah, so when you think about why things are not shared, adding anonymous reporting mechanisms can be one avenue. We've seen that here at UNM with our learning environment office, which has some anonymous-like, or at least confidential, probably is the best way to describe it, ways for problematic behaviors to be reported, or at least triaged in a learning environment. That's probably a very specific group. So one suggestion, I guess, recommendation is to consider whether the organization has that in place and still isn't seeing problem behaviors reported. I think we saw when we got Leo, we saw all kinds of stuff. It was like an escalation of reporting, which wasn't really meaning more things were happening. It's just that there was a better, accurate perception of how much was happening. So I guess probably my first recommendation is there a way to set up, and LEO stands for Learning Environment Office. I guess I should stop using acronyms. Is to see if there is a mechanism. Offices of equal opportunity often have those, but folks are often hesitant to go the more mandatory, the more formal route. Of course, there are a couple things at institutions that sort of slide under Title IX that you do have to go an OEO route in order to more formally address as sort of employees that are hired in institutions. I think there's a couple things that, like, I guess that stand out though about this question. You know, that the safety piece is worth spending time on. You know, is it physical safe, or is it sort of the psychological safety or repercussions or retaliation? And you know, I think that it really does come down to leadership, which is often, I think, the complicating piece of this question, because leaders aren't seeing it. That's perhaps suggesting that the space isn't one where that has been modeled as it's an okay experience for people to verbalize. So I guess the side piece would be going back to mentors and the role that mentors can often play in advocating and elevating concerns. The other piece is to push institutions to do anonymous climate surveys, where there is a opportunity to get accurate baseline institutional-wide data from groups that are not likely to verbally speak up, but can help institutions have a more accurate understanding of what is happening, and to share that data and be very transparent about the process of sharing that climate data. So tied to that, going to the question about conversations with leaders of workplace without being punished. So, you know, in a perfect sort of in the back of my mind, I'm like, well, we've got like systems in place to prevent retaliation, right? I have to sit through every year all of these modules about, you know, whistleblowing and patient safety networks, and how you can create better settings and not be punished. But when you come from an individualized group or a marginalized group where you don't have much lived experience suggesting that either you're believed or that somehow this won't come back and hurt you, it's hard to think about having that conversation. So I think one strategy that I have used is I've asked to join somebody else in the meeting. I ask permission for somebody who sort of comes to me and has a challenge and say, you know, would it be helpful if I was there with you as sort of your support, as a witness and a documentation to the conversation, so that if by chance there is further repercussions that happen, I can stand up and sort of say, you know, that was not what happened in this conversation with a leader, and be able to intervene. I think I've spent so much time on thinking about and on how to think about how to start a conversation. You know, the element of power and who you are plays into thinking about how you might address a leader, how well your leader knows you. You know, I think our chair does a great job of meeting with, I think, like every faculty member. And it's easier to start a conversation with somebody if you know them at least a little bit than it is if you don't know them at all. So, you know, creating opportunities for leaders to have more informal interaction with those they lead could be a starting place about at least creating the door. It doesn't address the being punished part, but at least it addressed the difficult conversation piece. Yeah, and you're welcome to add, Jeff, and you've got lots of wisdom as well.
Well, I'm wondering from just even the perspective of leaders, if kind of curiosity within those conversations in and of itself can ever be perceived as a microaggression in some way, or kind of making somebody feel different, or those kinds of things. Like, it's such a complex thing to conversation to get going. I appreciate your thoughtfulness about it.
No, yeah. Thank you. So you're thinking, like, as a leader, then engaging, like, if you were to question and start bringing
How is
in
it for you
how then
with your background being here, things like that?
Yeah, I mean, I think you could think about, like, I think we talk a lot about, like, ground rules when we do group therapy and group dialogues, but perhaps often a way to think about leaders starting conversations with engaging and just sort of, I don't think you'd want to call them ground rules, but just sort of how these conversations can go, what they are looking for, why they might be asking things, how to engage somebody in talking about what their preferred way of answering or engaging in questions might be, could be one way. I had never tried that. It just sort of popped in my head as I had
some kind of frame to the conversation. Yeah. Thanks. Elizabeth Ortiz Schwartz asks, Dr. Smart, can you please comment on ableism when it pertains to microaggressions?
Yeah, I think that the ableism is one that many DEI offices or DEI work, at least I feel, are playing catch up on. Even if you think about offices, a lot of times they don't include accessibility as a core component of diversity, equity, inclusion, and accessibility. So, we live in a world that I think is full of daily microaggressions that against those who may be differently abled. And I think that I see this oftentimes, I think I do see it in the verbals, but I think of this often with our what I consider the environmental microaggressions, with our spaces, who has access to buildings, to parking, to technology, and just, I guess, probably one recognition that I don't think we had closed captions on unless there's an option for somebody to turn it on personally. So, I think in acknowledgement that this presentation, my words could have not been accessible to some of you on this call, so I apologize for that. So I think that my biggest comment on it is that I don't think we do enough including of ableism in our conversations, diversity, equity, inclusion, and that it is a spot that warrants a lot more attention. I don't think that most folks are aware of the advantages they have until they don't have an ability. And so the first place would be more comment and more dialogue and more recognition of our systems, our physical systems even, and how they contribute to daily kind of environmental microaggressions for folks.
Great, thank you. Thank you. Just to add in there, Margot Gross says, thanks, enjoyed Dr. Smart's presentation, appreciate slides and PowerPoint, thank you. And Elizabeth Mendez has a series of questions here asking, are microaggressions specific to race and culture, or can they be white on white microaggressions, or black on black microaggressions, or even woman on woman?
Yeah, so a question really, like, is microaggressions just between groups or intergroups? And the answer is yes. I think there's one way to consider microaggressions is they always are in the direction of the oppressed group. And within a group of Black African Americans, you're going to have some that identify as the gender minority, or some who identify as individuals who may be immigrants to the United States, and those who aren't. For women, you look at socioeconomic status, or it could be an intersection of a woman who identifies as Black or African American and a woman who identifies as white, European American. We could look at within sort of an element of colorism that exists across all racial ethnic groups. So it's not specific to race or culture, absolutely, not just specifically. And it can happen anytime there's power differentials that are happening within a group. And, you know, I don't know if you've, one book that I found really useful was the book Caste by Wilkerson, I think it's Margaret Wilkerson, which really helps to think about like this system that we have of hierarchy and placing folks in different levels, regardless of what that could be. And if you think about microaggressions, they're happening a little bit in that framework. Within a group, somebody will have power. It's just, I think, an acknowledgement of the way power structures tend to work in America, that there's somebody who has it and somebody who doesn't, or somebody who has a resource and somebody who doesn't. And within that, there will be some stratifying, and that microaggressions will happen, and whatever that stratification might be, regardless of whether it's race or culture or ability, gender, socioeconomic status, or pretty much any of those diversity categories that often come with that definition.
Great. Any more questions out there? Please go ahead and add them to the Q&A. I guess, Lindsay, I want to ask you just from your perspective and what your office does, what do you think the most important functions of the diversity, equity, inclusion, accessibility officers or committees in an organization should take on? How should they begin? What their work, and what are the most important functions to keep track of?
I think one of the most important pieces is really knowing the people that work at your organization. And that can happen through setting up dialogue circles, that can happen through providing trainings, optional trainings. It's places where folks can come and just learn and engage on a topic. I think that tracking data and implementing policies and really focusing on how to improve climate are, of course, important categories. But if I break it down into the most important role that I think a diversity, equity, inclusion officer or champion could play is really getting to know as many people, if not all the people, and of course some organizations are huge and that's not possible, that you work with. And I think that that's a really foundational way that I approach it. I should say it's probably the best way of thinking about how I approach my work, is that that connection and that capacity to really see somebody's daily work experience and talk with them goes a long way in engagement in the work, building a culture of folks who also want to sort of pass it on and then get to know other people. And I think you spend a lot of time in your work, more than you often do with your family. So it's an opportunity to really engage in knowing people. I think it helps me to create a space that I like going to and returning to every day.
Can you just in a minute or so describe what those dialogue circles might look like that you mentioned?
There are, I think, a couple different models. They need to be small and they need to be closed groups, I think, with regular group of people kind of coming the same time every week, as opposed to open groups where it's just like, anybody comes at any given time. There should be somebody who's designated as a facilitator. It doesn't have to be a DEI expert. It's just somebody who perhaps has some skill set in kind of groups in some way. And they're an opportunity to come together and talk about specific topics that often do involve elements of vulnerability, though, so that the role of a dialogue circle is to be engaged in the process rather than passive. So it does oftentimes pull for sharing of our own personal experiences, not in a therapeutic way, but it can feel sometimes like you're sharing things that you feel like you don't typically share in professional environments. So I think that a lot of times what you'll see is that they are made optional and appeal to folks that feel comfortable with that type of setting. Not everybody likes group experiences, so I think that there should also be space for one-on-one dialogue rather than group dialoguing too.
And are those kind of open content, or are they around a given theme that's suggested when a group meets, or how does that work?
I think that the co-building is what's important. Usually the first one or two starts with some sort of opportunity to deeply get into knowing each other. So there's like strategies around cultural storytelling. What's in the name is an activity I have heard used, which is sort of unpack your name and how you got your name and how it connects to your family. And so there's some sort of activity that the first few sessions will set this framework of getting to know who you're in the room with, which is why the closed group is so important, that there's no new entry after the group started. And then from there, I think it's up to the facilitation and the group to really think about what's important to have dialogue around. I don't think it needs to, the model that I have used doesn't follow, but I think there are some prescribed models that might have a thematic element to it that somebody could become trained as a facilitator in.
And you run those kind of weekly, monthly, like how often does a closed group meet?
We did it, I guess, at UNM, like I think it was probably 2 years ago, and it was not very long. It was maybe across a few months, and then we haven't revisited it. So it's one thing that we got some data on in our department's climate survey to sort of see who would be interested in engaging in those. And at some point, we're looking to build on thinking through with our DEI committee, who might be interested in facilitating those and how we might do it.
Great. Daniel Greenfield writes in, from a forensic and litigation perspective, in your experience, to what extent, if so, and how have microaggressions and related topics come into play in alleged workplace discrimination cases?
Well, I don't have any experience directly. My sense is that perhaps the element of subtlety that microaggressions by definition have makes it a tricky litigation case without evidence. So I don't have a good answer for that one.
Great.
To follow up on, yeah.
One more question. I should let people know that in your clinical work, also you take care of many of the athletes at University of New Mexico, and there's a question about athletics here, saying recently in the news, negative comments apparently made at a Duke University basketball player by Brigham Young students or audiences. Both universities are trying to respond, but have reached a standstill. What to do?
That's a big question.
Yes.
I myself have just been sort of waiting to see what the secondary response is to the story. I think like many folks, I think you recognize that there's lots of things that happen that the news doesn't report until it happens to come out. And so I'm waiting to sort of follow it. I think that, this is, of course, would be an overt racism event that was experienced based on what was reported by the Duke basketball player. Yeah, I mean, I think what to do, if I were to think about this from a perspective of if you happen to work with student athletes, is to talk with them about it. Because my expectation is that young woman's experience is not the only person's experience. Again, the majority of microaggressions go unreported, and that would go from like things from other teams or even within teams. If you think about lots of stories that have come up about athletes' experiences of racism within their own sports units and coaches. So I don't have what to do is to support anybody in your network who might be a student athlete or connected with these institutions who's likely experiencing lots of stress as a result of this. And I think tying it to microaggressions, many folks who experience microaggression struggle with feeling like nobody believes them because maybe they're the only one who heard it, the only one who experienced it. And so just a plug for believing people when they say something has happened to them can be an important support you can do, regardless of whatever happens from a legal or in criminal investigation standpoint or whatever this one lands in. An ally has the capacity to trust that somebody's lived experience is true, and that could go a long way for somebody.
Great. We are getting to the end of our time together here. So Dr. Smart, thank you for your inspiring presentation. I should also let people know you're speaking in front of the Sandia Mountains there.
Yes.
The Sandia Mountains turn that color, looking a little like a watermelon, and Sandia means watermelon in Spanish, which is why they are called that. It's a beautiful, beautiful background to a beautiful presentation. So thank you. Thank you so much for being with us. Thanks to everybody who joined us today. As a reminder, for those wishing to receive CME and CEC credits, please complete the evaluation survey that will automatically pop up in the browser as the webinar ends. I like to say we've been kind of connected here in our virtual way through this presentation, and by thinking about a complex issue together and holding that in mind together, and suddenly we will be sent away into our rooms and alone and left to pursue the day. So just a warning about that transition before it happens, because it can be a bit alarming. And more thank yous are appearing in the chat, Dr. Smart. So thank you again for being with us, and hope everybody can join us to be with Dr. Bogenschutz in a couple of weeks. Thanks again.